No way, bro. How you doing? It's been a while.
It has been a while. Dude, not that good actually. My girlfriend just called me and she's HIV positive. So I'm a bit scared right now. I don't know.
Dang, man. I'm sorry to hear that. I gotta head to class, so I'll see you. Dang, I should go to the doctor. I might have HIV. Hey.
Hey, Rafi, what's going on?
So, I've recently been in contact with a buddy who might be HIV positive. Should I be concerned?
So by in contact, what do you mean?
Well, I was standing within 6 feet of him, and I think I almost touched his hand.
Oh, okay, well, no need to worry. It seems you might have a misunderstanding of how HIV works. So many studies have been done to illustrate these misconceptions.
Really? How so?
There was a study made to address how HIV is actually transmitted, and it is called viral load and heterosexual transmission of human immunodeficiency virus type 1.
Really? Could you elaborate a little more on that?
Of course.
This study, conducted in the year 2000 by Thomas Quinn and his colleagues, was motivated by the desire to further understand what the risks and consequences of heterosexual HIV-1 transmission was. Particularly, the study focused on transmission in sub-Saharan Africa, where heterosexual transmission is the most common form of infection. To understand the objective of the study, we first need to understand what something called viral load is. Viral load refers to the amount of genetic copies of a virus in someone's blood. Typically, a higher HIV viral load corresponds to worsened symptoms and higher contagiousness, as expected. This study's objective was to determine how viral load, among other factors specific to certain demographics, would alter how infectious and contagious HIV-1 specifically was with more detail and precision. They particularly focused on how HIV viral load affected the transmission of HIV.
To achieve this objective, the authors created a study involving 415 heterosexual couples in Rakai, Uganda, and following them for 30 months. In this study, one partner in each couple was HIV positive and the other was HIV negative. The researchers then measured the HIV-1 RNA levels and components of the blood of the HIV partners and statistically modeled this information to examine the relationship between the HIV concentration in each person and the risk of transmission.
An important conclusion found by the author is that the study found a strong correlation between plasma viral load, the amount of a virus present in the blood plasma of an individual, and the risk of HIV-1 transmissions. This means that those with a higher concentration of HIV-1 RNA, the genetic material of the virus, in their blood were much more likely to pass the virus to their partner. This emphasizes the critical role of controlling viral load, such as using antiretroviral therapy, ART, to suppress the viral load in an infected individual. This therapy combines different medications of drugs to manage the virus and prevent the progression of AIDS by preventing the virus from replicating and separating within the body. This therapy has transformed HIV from a death sentence to a manageable condition for many individuals, which dramatically decrease the amount of HIV-related deaths.
Certain ethical concerns were raised by leaders in medical ethics. For example, Dr. Angel, a respected physician and researcher, wrote a letter criticizing the study for not providing ART to participants, despite its ability to reduce HIV transmission. Similarly, she noted that partners were also not directly informed of their risk for contracting the virus. The authors then responded, saying ART was unavailable in rural Uganda during the time, and emphasized that the research aimed to observe how HIV transmits in natural settings, not to provide treatment. Regarding the disclosure of HIV status, they explained that Ugandan policy prohibited forced disclosure of test results to protect individuals from social discrimination. Instead, they provided counseling and encouraged voluntary disclosure. The authors further highlighted that they offered free HIV counseling, condoms, and treatment for sexually transmitted diseases.
The implications of this research were incredibly crucial to the fight against HIV and AIDS, specifically in treating those who were already infected and preventing further transmission from those individuals. The study showed that controlling the viral load was more important in preventing transmission and high virulence, which means how bad the symptoms of the virus are. This meant that the best method of treating HIV and preventing the development of AIDS would be some sort of treatment that reduced viral load, like the then new antiretroviral therapy, or ART treatment, although it was not very accessible yet in the setting of the study. When viral load was reduced to below 1,500 copies per milliliter, transmission became negligible, meaning that these forms of transmission could help HIV-positive individuals live more normal lives.
Thank you. This has all been really informative. But I originally thought that only guys can transmit the virus. Is that true?
Well, no, that is a common misconception. Girls can also transmit HIV. So, as you can see in this graph, there is no significant difference in transmission between male to female cases and female to male cases. So this means that both men and women are susceptible to transmitting the virus. Therefore, one's gender has no effect to transmitting HIV.
Really? Well, this entire visit has been really informative, and it's really worked to calm my nerves. I also appreciate it, because with this new information, I know what to do in the future to not contract HIV.
So you see, when someone is HIV positive, you are at no risk when you are simply near someone who may have it or hand-to-hand contact, but rather certain preventative measures such as ART, which is treatment for people who have HIV, and consistent protection during sex will prevent this disease.